Good evening and welcome to episode 5 of season 2 of the No Stroke podcast. My name is Dave Dancer. I'm here with my co-host this evening, Michael Garrow. Good evening, Mike. How are you?
Well, David, happy Tuesday. Let's start off with the fact that you guilt tripped me into going for a run this past weekend. One that it was very overdue for sure. So I'm happy I did it, but I also wore a pair of shoes that were a bit too small for me. So now I've been limping around the house, and then that happens. It's like, it's almost like it's just a muscle bruise, but it kills. So I did the 5K. I was flying. I felt great on Saturday, but ever since then, every time I take a step away from my desk, I think of you. So
I'm glad my strategy worked of the night before. I'm reminding you to put your shorts and your sneakers. Maybe it was too early in the morning and maybe you grabbed an old pair of sneaks that you should have maybe given a little more thought to your footwear. Is that?
Yeah, look, no need to, I know I made the mistake. I just wanted you to know that
it was all in good health for you because you came off a very, let's say, aggressive month of wedding crashing. Then there was, I think, a beer fest somewhere in there just to get in the spirit of October. And now we're in November and your health is my top interest. So while I ask you to maybe just raise we don't normally do this, but Mike, I'm putting you on the spot and you have to on the video cast. We had well intentions to make a physical fall meeting here. And because of your busy travel schedule in the coming month, we're not going to be able to make that happen. So we are virtually having a toast. By the way, I'll describe that I have my very last Sam Adams summer ale. And Mike, of course, Mike, what do you got?
Well, it's a Guinness glass, and for any Irish folks who are going to listen here, well, cheers first off.
Cheers. We did it. Okay, that's as close as we come. We started this whole mission virtual. We can continue virtual. And by the way, Sam Adams or Guinness, if you want to pop in and give our show some sponsorship, we're not gonna balk at that, right, Mike? We don't promote drinking all the time, but I'm gonna say that I'm glad we actually could at least make this happen virtual. So Mike, with that said, it's a rough transition, but in the news, what struck you this week?
Before we transition in the news, let's let the guests know that we're trying something a little different this week, right? So we have an excellent guest this week, someone that we teed up from our previous episode from UConn Health. Really exciting, and it was an amazing conversation. We just wrapped that conversation up, and now we're recording our intro after. So we didn't drink through the podcast, but we did have a a celebratory beverage after we finished it up.
Thank you for that. Thank you. That full disclosure, Mike. Thank you.
Yeah, I mean, not that I think anybody would, really mind, but just lay it out there. So let's talk in the news. It's been a week of stroke in the headline again. One that I know that it was a surprise. We'll touch on that, but then I think the one that you'll probably dive into hits home for you a lot closer, with what you're doing in a virtual environment through your PT consulting. So let's start off. So last night I walked in the house and NBC was on the television, and they're talking headline, type of fat, not how much, linked to stroke risk, study finds. So this pretty much explained that fat from animal sources were linked to higher risk of stroke, while vegetable fats were linked to a lower risk. So I mean, I'll let you run with that one because I know you're going to be very opinionated on it. Second is it was on Neurology Today, but really what they're talking about is the challenges of maintaining telehealth access in the now, hopefully, as we continue, there might be, hopefully we don't get what Germany had with another surge, but this post-pandemic world. and I think it's been a question, for a while now. It's, all right, telehealth, it's been beneficial through the pandemic. Obviously, the codes and everything kind of went out the window during the pandemic, but now once we adapt, what's this model look like? And even our guest today spoke to a hybrid model, right? So I think everybody believes that's going to be the future of healthcare. But yeah, I know you dove into that article, so let's take your pick. First off, give me your opinion on the NBC News article.
Well, I don't know. There's like, I don't have a lot to say. It's like mic drop on that one after I say, well, I probably walked in the house around the same time. And I was like, anytime anything flashes, we're probably like ready to take notes of what's new, what's exciting. And wasn't all that exciting. When I went and looked for the follow-up information, because sometimes they'll give that splash for 15 seconds. There wasn't much more to that 15 seconds to splash, other than my opinion is like basic education. There's not a lot of, there shouldn't be a lot of surprise to that. A high fat, animal fat based diet, not best for the cardiovascular, cardio, just overall health. So I don't have a lot to add to that. And, even with the nutrition background and what we now know about the diet and health link and stroke risk link, I think that I don't know that it really merited making the national news, but any education about stroke is a good segment to have. So I'm thankful for that. But there wasn't a lot behind the details of that particular study. So
if there's one good thing we know, at least it wasn't fake news. So
yes, good point. Good point. Right. So if we transition to the telehealth and the rolling back of the guidelines, or just kind of the way, that article that you mentioned was in Neurology Today. It was done by Gina Shore, and it just came out November 4th. And I do have a little bit more to say on that, because although the article was referencing care from the stroke care teams, neurologists, I lived it and still live it as a rehab professional doing mostly telehealth these days. It painted a good picture, and maybe we can put this in the show notes too, about the differences. Just depends where you are looking for service. The experience can be entirely different. And they gave the case of neurologists in Wake Forest and North Carolina, Chapel Hill, where having patients try to, seek services by driving into parking lots across state lines to be able to still legally see a neurologist, because some of their guidelines and ability to get reimbursed for the care they deliver via telehealth, some of those things had rolled back. Not all states. I think the article points to, since the pandemic, waivers are become permanent for some in 18 states. And I'm just looking down at my notes, but in 32 states, they no longer have these waivers. So there's a lot of bills being introduced. And even at the Medicare CMS level, we started with e-health visits being permitted, in rehab, then we were holding back, and then full telehealth came. That's still right now enforced, but at the Fed level, that's still something that's being debated. So they talk to a lot of the pain points and a lot of the barriers to care. But bottom line, and it kind of segues into, our guest in terms of what we talked about is coordinating care. What gets lost in this is you're losing opportunities to have those touch points with the people who need it most. We learned that it can work during a pandemic, and we've learned also that it's definitely going to continue to be needed if we're going to have effective delivery of these new care models. Like, sometimes it's referred to digital first, but there's this support that virtual can do very well and effectively when it's the right case, but it's a lot of time the legislation that, of course, makes the waters a bit muddy on terms of who can receive it.
Yeah, that was a great overview, David. And, it does make a good transition into our guest today. But I think it also, in conversation with our guests, we were able to see that it's still pretty old school in many places, and not to say old school doesn't work, because like you said, sometimes the best place for a reminder is, the magnet on the fridge. But when we think about, true engagement and tracking outcomes and moving into, value-based care, digital needs to fit in that, and if there's one thing we know with healthcare, it's, now that telehealth is needing to be regulated, it's not going to be easy. If anything we know about healthcare is it's always going to be complex, and adding an element of telehealth is only going to add more complexity to the fire. So as much as the discussions are needed and, obviously warranted for, and I think as you listen to our guest today, so yeah, Brooke, as you listen to Brooke and her explain, really her role and how she supports patients, it's so evident that there's a digital solution needed there, right? When you think about those touch points, you think about her managing, physical folders for all these patients and all the different appointments, recap with the caregivers. There needs to be standard models of care that incorporates digital, and obviously telehealth is a big part of that. So before we dive in and start, share the conversation with Brooke, what were some of your biggest takeaways from the conversation today?
I love the term and the role. I've heard the term navigator used in a lot of other support roles. Cancer comes to mind, diabetes. In stroke, there's no bigger responsibility than positions like Brooke holds, as far as taking those critical next steps and helping the family get the best possible outcome services at the right time. And I love one of the things that we'll dive into with her. I love the hybrid support group that came out of their necessity to go completely virtual, but then to include those who wanted to remain virtual for various reasons. So pay attention to that when we dive into the interview, because that's where I see there being a big future and ability to include more in the discussion, for whatever reason, but for the ability to actually go outside the clinic walls and the hospital walls in this case.
Absolutely. Yeah. It was, I think Brooke was an excellent guest. As we're, bringing a more diverse kind of, group of guests in, it's amazing just to hear just episode after episode, the passion that these folks have to their role, whether it's, we go back to Banga at Newgate and, that patient story he was able to share, but, Brooke and, other stroke navigators who are out there, they're in the thick of it. They're the ones untangling the weeds for these patients, caregivers, and
absolutely,
loved ones to really, support in that moment when they think all is lost, so it was amazing to hear from Brooke. Obviously fit well that, in our last episode, we spoke to the UConn symposium that happened through, just a week back now. And we also got the great news that it's recorded. So we'll share that link. Anybody interested to listen back, it sounded like it was an amazing event. You guys are more than welcome to go back, listen to it. And if you have any questions, reach out to us. We'll ping Brooke, or if you want to, reach out to Brooke directly. we also share all of her contacts in the show notes. So with that, I hope you guys, I think you're going to really enjoy this episode. And David, cheers our November 2-year anniversary of
2-year anniversary in November. And before we wrap up season 2, we do have our schedules filling up fast with guests. So we are going to be doing probably some double sessions if we need to during the week to get everyone in before you take the next flight. I can't call it back
on
home.
EU soil. I can't.
Yeah,
no, it's
EU
not
soil.
back home.
Yeah,
not
you
back.
can't
And
call
you
it
know
back
what?
home. Your second home. Your second
Yeah.
home. Okay.
And only me. Yeah, I'm going to a winter holiday to the dark and rainy Ireland. But really looking forward to it. So yeah, it'll be a busy month in November, but have some, like David said, some amazing guests. So everybody, continue, like, subscribe, share, and get the voice out there, because we're doing this for you guys, and we hope it's helping. So with that, let's get to the episode with Brooke Medel, stroke nurse at UConn Health Center.
Enjoy this episode.
Good evening, everybody. We are now joined by Brooke Medel, a very timely guest. As if you remember in our last episode, we were just discussing UConn Health Stroke Symposium. So we moved quickly. Medel was kind enough to join us here on late Tuesday evening. But yeah, Medel, welcome to the No Stroke podcast. Thank you for joining.
Thank you, Michael, and thank you, David, so much for having me. I'm honored to be here.
Well, I have to say, when we talked about the event in our last episode, and it's great to see awareness. Obviously, with it being Stroke Awareness Day, last week on the 29th of October. I know it's crazy how quickly we're getting into the depths of winter here, but it was nice to also see something local happening. At least for me, I'm a Connecticut guy, so UConn's not too far down the road. And it seemed like the event went very well. So we're definitely keen to kind of drive in and understand a bit more about who are some of the speakers, some of the key takeaways. But before we do that, Brooke, let's dive into your role within UConn. So I understand you're a stroke nurse navigator. You've been there since June. So I myself just started a new role in June, so I could understand, like, you're getting your feet wet. There's crazy things happening, but you were saying before we started that it's you've moved from a few different hospitals. So you've been a nurse for about 3 years, moving kind of in a direction of a big hospital system down to a smaller. So talk us through that. What's your day-to-day like as a stroke nurse navigator?
Sure, yeah. So like I said, I'm pretty new in this role, as you said. I started in June. Before that, I've been an ICU nurse my whole career before that. So I've always taken care of critically ill patients, very sick stroke patients. And it's really cool to now have a new perspective on the other end of the spectrum, being in a stroke nurse navigator role. So this is a pretty new role in general, besides just here at UConn. In general, the nurse navigator role was created to help that bridge between the inpatient to outpatient setting, especially with something like a life-altering event like a stroke. Patients are found to be completely lost, and they're so overwhelmed with the change of their life. And to throw on top of it, all these appointments, rehab sessions, MRIs, echocardiograms. The families just don't have enough resources and support, and they kind of feel like they're lost, and they get discharged from the hospital and they're told to wait 6 weeks for their first appointment. And so many questions come up. So that's why this role was created. And it's just been so rewarding for me and for the patients. And pretty much my day by day, what I do is I keep track every day, all our stroke patients and stroke workup patients that are coming in the hospital, so I can have an idea of who I'm going to be working with. I try to meet them while they're in the hospital, get my friendly face so they have someone to connect with when I meet them outpatient at the stroke clinic. And I give stroke education at the bedside to the patients, to the families. I try to go to the stroke codes to be extra support for whoever needs it, whether it be the stroke victim themselves who's waiting on the CAT scan table anxiously while the team decides if they're going to give TPA, or if it's to hold a family member's hand while their loved one just got rushed to CAT scan with 20 team members. I'm there to just be that extra support for however I need to be. And after that, I work very closely and finding out if the patients are discharged. I do a phone call follow-up about a week after they leave to see how things are going, if there's any loss in translation with medications or what it may be. And then I meet them at the stroke clinic at their outpatient appointment just to kind of be that extra support person for them, because although there are lovely family members that are able to be there, it's not always the case for every patient. So I'd like them to know that they're not alone through this process, and I try to help them cope and be there however I can. And it's easy to talk to a nurse sometimes, a little bit easier than to a doctor. So I like to have that open communication in that relationship with the patients. So I gotta say I have a really cool job.
And your description of your title, what you just described and all the duties that you carry out, that navigator, it's truly very fitting in terms of what you just described, because they often say that the gains that come post-stroke, often that role in transitioning to the services that are in place to set someone up for success often are as important as everything. Of course, the first thing to do is, if we can prevent at first a stroke, that's the best outcome, right? But when you have those transitions and those care coordination, and things can go the way you described to fit all those areas of need that sometimes go unfulfilled. It's so, like, your role is like, you're a champion. So thank you for doing, and thank you for coming on the show too at the end of probably a long work day, describing what you just did. That's a busy day right there in itself. It sounds like you work a week and a day. So thank you. And do you want to add, you were mentioned at the beginning, it was we were glad to spotlight the symposium that you put on there for the World Stroke Day. I always get that confused with the World Stroke Day, and here in the US we're looking at May, and then we look at October, but whatever we're going to call it, if we bring attention to what we're doing here today as part of our show as well, we're always glad to promote events. So you want to talk a little bit more about the speaker lineup, and maybe share some insights from that event for folks who might not have been able to attend?
Yeah, of course. Again, thank you guys so much for the shout out. Our whole purpose of our events like that, our community events, is to reach out to as many people as we possibly can. Our Stroke Survivor Symposium, this is now the third year that we've been doing it. The guest speaker was Dr. Sanjay Mittal. He is our director of stroke here at UConn Health. He discussed the importance of stroke prevention and treatment, as well as ways to manage stroke risk factors. And then it was followed by three of our guest speakers, which were our stroke survivors themselves from our Stroke Survivor Support Group. They went over, all different ends of the spectrum. We have a young stroke patient who was able to get a thrombectomy. We had another young stroke patient story who had TPA. And then we had one of our stroke patients that had a stroke, over 10 years ago, and talked about how he went from being a practicing paramedic to unable to do his job, to working really hard in rehab and with speech language pathology, and able to be currently again practicing as an EMT. So, getting to hear different stories from different perspectives, I think that's the most heartwarming of all. Our event is recorded, so if anyone did miss it and they were still interested to hear the event, it is recorded and it is available for others to hear. One of our stroke survivors, and this is the whole reason why we do these kind of events, like I said, is to educate the community. And one of our stroke survivors who actually spoke, his name is Devin, he ultimately was turned away by some of his neighbors in his apartment complex when he was experiencing his stroke symptoms and was attempting to plead to call 911 even though he couldn't speak. And I cannot help to think that if all community members were educated on signs of a stroke, that maybe that wouldn't have happened and he wouldn't have had to climb another flight of stairs and attempt for another neighbor to call 911 for him when he was unable to talk. So I think by attending or listening to this event later on, that there's just so many things that people can gain from this, and education is so important. I can never feel like you can have enough education, whether you be a stroke survivor yourself, a stroke survivor caregiver, or a healthcare provider, or just a community member. You never know when you might need the education. And although I hope none of you have to, I feel like you can never be too educated on this stuff.
Yeah, it sounds like, you know, the power of Zoom as well, being able to reach more people. I assume when you first kicked this off, it was in person, and you know, and now, you know, you have much greater reach. And I think, you know, it's certainly some of the potential of Zoom and being able to have, you know, reach a larger audience. But you know, is there any thought maybe to have this in person over the next year? Yeah.
Yes, that's definitely the goal. I think we'll always do a hybrid approach because we want to be able, like I said, to capture as many people as we possibly can and to not have the physical restrictions. I think it's great. But our plan is for sure to be in person real soon. Even at the end of the event, Dr. Medel was like, oh, we need to have this in person again next year, because the physical connection and being able to see the individuals firsthand, it has a whole different emotional toll on you, and you get a whole different type of connection. So we really look forward to having our event in person next year. Just, you know, with the hospital restriction guidelines, obviously it was unable to happen, but trust me, that's what the goal is next year. And we really look forward to it because we get a really great turnout when it's in person, because like I said, that physical connection and emotional connection you get, there's nothing else like it, honestly.
I'd have to agree. And, you know, we launched our kind of support through Enable Us, right, actually at the start of the pandemic. So David and I, we've actually met face to face one time, two times, but even I was previous to being in Connecticut, I was living in Dublin for about 6 years. So, you know, David and I kind of launched this, met virtually, and then with the pandemic happening, you know, we started virtual support groups, which was very unique because, you know, we were able to tie in folks from Ireland, the UK, we had some folks from Canada, and obviously the US, all attending these virtual events. But I have to say, you know, that in-person connection, it definitely makes a difference. So maybe let's dive more into that. So talk us through kind of pre-pandemic, what did the support groups look like? You know, did you have any of these designed previously in person? And then obviously now, since the pandemic, when you joined in June, these were all virtual, right? So how have people been responding in support groups, and, you know, what does that structure look like at UConn?
Sure, thanks. So, you know, pre-pandemic, everything was in person. Zoom and WebEx was barely even a thing before the pandemic. So everything was in person. We were meeting once a month, physically, face to face. Obviously, this was before I started my role, but that's what was the structure. Once the pandemic hit, obviously everything changed, but I think all considering, we were still able to give the patients the support that they needed. Jennifer, our strokes coordinator, did an amazing job with the situation at hand, because just because we were in a pandemic, stroke victims don't stop having strokes and they don't stop needing the support. And going through a pandemic and being perfectly healthy physically and mentally is so exhausting. And then throwing in a life-altering event or having a new disability on top of that, that's going to make you feel more isolated and alone than ever. So we definitely, our program made sure that we kept having these events and kept having our support groups monthly online, giving all the support that we possibly could. Keeping that phone connection too. They have direct access to mine as well as Jennifer's phone numbers, and we're there to be that resource for them at any time. They have our numbers, and we always tell everyone, please reach out if you need anything at all, because we want to be as personal as we can, even during these times when we're sometimes not allowed to be. But now I'm fortunate enough where we're able to now meet hybrid again. So we are currently meeting in person as well as having it online. We're meeting in our large conference room. It's got a great big screen on the wall. So our people who are attending virtually, they're on a huge, probably like 85-inch TV. So we're able to see their faces up nice and close. And they get a view of the entire conference room where they get to see the stroke survivors that do attend. And we all get to connect in a new way. And I think people have been finding it really positive because more people are able to attend for the ones that work or, you know, maybe don't live in the area anymore, but still want to be a part of our support group and our program. But it allows people who don't love all the technology or, you know, really miss that face-to-face. Sometimes it's one of their only outings of the month and they really look forward to coming to these support groups. So I'm holding on and keeping them in person for as long as I can and until rules tell me I can't.
That's a really interesting hybrid mix for a virtual group. That's so if they're not there, they're on the wall bigger than life, it sounds like. So they're
Pretty much.
That's great, Brooke. Can you tell our listeners what night, what day or what night, when do you meet during the month?
Sure. Yeah, we currently meet on the fourth Wednesday of every month from 12 to 1 p.m. So it is currently during the day. And we are meeting, like I said, online as well as in person. We meet in the outpatient pavilion at UConn Health, and I will give you guys my information to share at the end of this for anyone who's interested. If they want to be a part of it, they can be a part of my email chain and they'll get all the updates on all our meetings. The current meeting that's going to be happening this month, though, is going to be on Wednesday, the 17th from 12 to 1. It's a little bit off of our course. It's the third Wednesday this month, but that's only because of holidays coming up. But I didn't want to stop having the sessions because of the holidays, because again, around the holidays could be a time where, you know, you need the support more than ever. So I didn't want to dismiss the need for the support group. So I just changed the time a little bit, but we're always going to be available. So
great.
Please attend if anyone's interested.
Like
I said, I'll give my contact information.
Yeah, we'll definitely put that in the show notes too, for sure. Thank you. If you include that after, that'd be great.
Yeah. Brooke, now let's backtrack to when you mentioned that unfortunately strokes are going to continue through the pandemic, right? So they continue to happen and there continues to be support. But when you're now kind of seeing folks come through, right? What have you seen any changes in terms of access to certain programs, access to, you know, if you just think of overall barriers, you know, that stroke survivors and their caregivers and loved ones are going through? What do you think has shifted, you know, pre-pandemic to now? And like, have you seen behaviors change at all in terms of, you know, what they expect from out of a rehab program as well?
I would say that, you know, that especially that personal connection sometimes is being missed a little bit post-pandemic. You know, these rehab centers are very, very cautious of their visitors. They're very cautious of their staff because although we're not in the heart of the pandemic in the numbers that they used to be, we obviously don't want it to get back to that point. And especially these patients in rehab can be very sick, and they need to make sure that they're protected. So I feel like in that sense, sometimes families don't feel as connected and a part of family meetings, and you know, feeling like a full member of the team from, current experiences that I'm hearing from patient family members that they've been, mentioning to me. So although I find that that's unfortunate, it's not a tell all be all. And like I tell all of them, you are your family member's biggest advocate. And if you were to ever feel that way, you need to openly communicate that with the team, because as a healthcare provider, sometimes you have tunnel vision and you kind of forget that there's actually people that you're taking care of. And I know that sounds mean to say, but you're so focused on just making sure that they're safe, they're getting all their meds and doing all these things. You're forgetting the big picture sometimes. So sometimes just having someone acknowledge that, they will take a step back and realize, okay, maybe we haven't talked to them in 4 days and they're not aware of the plan. And maybe that's why they're feeling a little bit anxious. And, communication goes a real long way. And like I said, you will always be your family member's biggest advocate. So just know that communication is key.
I had a follow-up question, and it's maybe I think you came in on the team maybe when things maybe were starting to open up, but as a rehab professional, I'm always wondering, because we've talked to other folks throughout the country when things were shutting down, March, April, May. I think you said you came on in June. What was the outpatient clinic and the rehab team, were they able to continue to provide services, or was it a period where things completely had to shut down from a care delivery standpoint in person?
Yeah, that's a great question. Personally, here at UConn, we shut down the clinic for in-person visits for a very brief time, only a few months, I would say. But everything was virtual. And that's for our rehab center as well as our stroke neurologist appointments. So our clinic closed physically, but never fully. We were still having virtual visits with the patients and still working with the exercises, doing that extra physical support, emotional support, as well as the education and the full stroke workup that's still needed, because just because we're going through a pandemic, you can't just ignore the fact of everything that's going on with the patient's health, and it's still just as important. So that was the beauty of Zoom and WebEx and all this technology during this time, and I'm ever so grateful for it. And thankfully, we've now opened back up, and we're meeting all our patients in person again, and the rehab center is completely open. So thankfully, we're getting our normalcy back. But it was a difficult time for everyone, and I truly sympathize and empathize with everyone that had to go through this kind of event. And then, like I said, during a pandemic on top of it, it was no easy task, that's for sure, for anyone.
Great. Yeah. And, I feel like, you've come into a role that you've been helping people at a time when there's a lot of confusion, and, you opened up kind of talking about your role really to bridge this gap, right? When you're coming home, and at what stage as a UConn Health Center, like what are you guys actually providing at that discharge phase when you bridge that gap, right? So when you think about just the complexity of appointments, different therapists that they need to be seeing, all these open questions, do you provide like packets, or what information are you sending, or is it to you on your role, on your shoulders, to like be giving them all this education and keeping track of appointments? Like, how's that work? Because I can imagine that's a big barrier.
It is a big barrier. We do a interdisciplinary approach. Our neurologists that see the patient in the hospital, they're the ones who make the recommendation of needing the stroke workup outpatient. We're currently working as well as with the cardiology department on getting echocardiograms performed outpatient, getting a heart monitor put on a patient. And then a big portion of it is me. So like I said, part of my job with meeting the patients while they're in the hospital, I make individualized folders for patients when I'm able to meet them in the hospital. And in that folder, I put the support group with my information on it. I put whatever information is needed for that patient. I try to tailor it depending on their needs. So if a patient really struggles with hypertension, I give them some AHA flyers and information on the importance of not living with hypertension, as well as the importance of medication adherence and going to your doctor's appointments. Whether it be emotional support, I will follow up with them more closely if I feel like they need to, as well as put in a neuro social worker consult outpatient as well. So like I said, I really just try to tailor it to what I think the patient needs and give them as many resources as possible. And I always tell all my patients, because they might not think that they need the resources. They might think, oh, there's someone more sick than me, or no, I'm lucky I have family that cares about me. But you never know what the resources have to offer if you don't try to take advantage of it. I always say just look at all of them, find out a little bit more information, then just filter through what you need and don't need, because you really might not know how helpful or beneficial it could be for you to have these extra resources, and you never know if you don't ask. So I always think to have an open mind is the best way to go about it.
Interesting. And like how, I'm just trying to drill down like this, we have a question around looking at how, technology has aided, through this process in the post-pandemic world. And now, we're moving to more of a hybrid model, but, for you personally to manage that, are you using MyChart or Epic? Like how do you, I know you said you have is it actual like physical folder that you're using, or is any of this tracked like back into MyChart and digitally through EHR?
So we do use Epic. I personally give physical charts because or physical folders, because
everybody likes that.
I think
hard copy.
People still like the hard copy, like you're saying, as well as maybe they're bored one day and then they decide to read through the flyer and actually like read the information and have it like click with them, and them to have some kind of like physical resource for if they're stressed or in a certain situation, they know they can just open the flyer and look to see what's in there. But we also do work really closely with all our stroke units. All our nurses at UConn are just so great in making sure that they attach documentation in the MAR, as well as the electronic health record. With their discharge summary, they put a bunch of stroke education information as well, whether it be the patient had a TIA, or if the patient recently was diagnosed with diabetes, because that puts them at a higher risk for stroke as well, ways to have a healthy diet. So the patient has a lot of ways to receive the educational materials that we offer, but specifically the folders that I do, it's all old school hard copy.
Sometimes putting stuff on the fridge is not a bad method too, right? So
I give magnets sometimes too.
There you go. It works. Can I a follow-up question to that is on the stroke clinic side? I know I mentioned at the beginning, the best outcome after a stroke is not to have that first one, right? But if someone, do you get referrals for someone who might have had that first TIA, may come in scared? Like, do you get them sort of as that before that maybe that first big event, but they've had those warning signs that we talk about, that there's a higher incidence that could lead to another event? Do you get referrals to your stroke clinic early on like that? Is that the way your model is designed to try to intervene early?
Absolutely. Like I said, when I do keep track of all our stroke patients that get a stroke workup, any patient that's diagnosed with a TIA or a stroke, they are followed in our work clinic. And you would be surprised, it's a lot of the times, a lot of the patients I'm talking to, long phone conversations or have those high anxiety moments are my TIA patients. They're petrified that they're going to have a stroke. It really is a wake up call for them. And, any little numbness or tingling in a finger or in their face for even a brief second, it's like they don't know if they need to call 911 again. They're very scared. And I always try to reel it back with education, because ultimately 80% of strokes are preventable, which is a great number. So, just learning what your personal risk factors are, and knowing what you can do to change them. The ones that you do have control over, like blood pressure, exercise, diet, smoking cessation, all those wonderful things, that'll just alone hopefully put you at a lower risk. And another thing is really just making sure that they have that resource person, which I'm there for them. So I find that helpful because, like I said, sometimes I'll get a phone call where they're worried about a brief numbness episode. So whether it be I move their appointment a little bit closer and sooner, so the stroke neurologist sees them sooner, or, I refer them back to the ED and have them call 911. I do whatever I need to do to make sure that the patient feels supported and educated.
Sounds like you could use an assistant. Busy woman.
Maybe one day, yeah. Definitely, as our stroke program continues to grow, I definitely think I'll need an assistant.
Well, Brooke, we love to kind of recap and end on a question that we ask all of our guests. And this question is, given your experience and given, both your clinical experience, but also the experience that you've had dealing with stroke survivors and caregivers, loved ones, and, now in this post-pandemic world with folks used to what Zoom is and technology in the healthcare experience. If we gave you a magic wand and you could redesign the stroke rehab experience, obviously prevention would be key for the first one, but what does that post-stroke rehab experience look like to Brooke Medel?
Well, I loved that question. It made me smile the first time I heard you guys ask me. Pretty much what I would want the rehab experience to be for my patients is to really focus on that long-term recovery and prevention. I feel like the focus with stroke rehab is mostly, if not all, physical. And although physical recovery is extremely important, being able to regain mobility and whatnot, I think that the emotional rehabilitation and getting, an activity routine, getting a gym membership, healthy food programs, I think those are so important for, long-term stroke improvement, as well as, knowing your resources with whether it be a support group or needing a case manager or social worker, finding out on ways to have services and rides for appointments, what it may be. Like, I think the long-term improvement is what's so important. And I wish our healthcare system was designed better for that situation. I feel like they're always focused on the short term, how we can treat the patient in the shortest amount of time, spending the least amount of money, but they don't understand that actually hurts them in the long run, because you're selling them short and they might end up getting another stroke or, having other medical issues later on, because we're not doing that full follow through and making sure that, they're getting that healthy diet and access to healthy foods and access to gym memberships and support groups and all those other wonderful resources that are offered out there. So
we share
my wish.
We share the same magic wand in many ways. From what you just described there, Michael and I are doing. That's what the end we're working towards. So I'd like to give you a chance to, after looking at your website, you and your team have had some really great recognition that comes with a lot of hard work. Do you mind mentioning and maybe giving us a little bit of a, I have to look down to read it, but the Gold Plus, you have high performance recognition in 2 areas that is on your website. Can you talk to that and how you get those distinctions? And I know Mike is, this is where I have a trouble wrapping things up because there's so many things I want to ask. If you wouldn't mind just taking a minute, and then, well, definitely it's been a long day for you, and I'll end with that one. I just want you guys to, give yourself a pat on the back.
Well, thank you, David. So yeah, I mean, here at UConn, our stroke program we really call our patients, part of our stroke family. And we really do our best to treat our patients that way. Fortunately, UConn Health has been given the Gold Plus Get With the Guidelines Award for 5 years in a row now. So every year that we've been eligible to get the highest award that we could possibly get for stroke awards, we have been receiving, which is a huge honor for us. And it only attributes to all the hard work that all our staff puts into this. So there are best practice guidelines for every stroke patient where we have to meet certain times, certain medications, certain education. And clearly with that award, our program has gone above and beyond that, and why we've earned this Gold Plus award. So it's just acknowledgement of all the hard work that we do and all the pride we take in serving our stroke population, because we really do treat all our patients as family and do absolutely everything we can to give them the best possible care that we can give.
Well, we're glad to spotlight a job well done. And with that, Michael, I promise you, unless Brooke has questions for us, and you've had a long day, and I know this has been really great to be able to showcase your work. Yeah,
we'll be sure to copy all links to UConn Health. If there's any direct links to any of the support group signups, anything, we'll get those in the show notes for after. But are there do you have a social media, anything like that, if people wanted to follow either you personally or UConn Health as well?
Sure. Yeah, I will give all my information out at the end of this. I'll give our stroke survivor group flyer that has all my information if anyone wants to reach out and be a part of the group. One of our stroke survivor members, actually, her name's Drea. She also spoke at our Stroke Survivor Symposium. She created a Connecticut Stroke Awareness Facebook group. So I can provide the name of that at the end of this as well. And
perfect.
And please give it a follow. She actually gives all our guest speakers and all their information from our support group. She posts that all on the website for other stroke survivors to have access to. And it's just a really great place for stroke survivors in Connecticut to connect with one another. So I'll share all that as well. And again, thank you guys so much for allowing me to be here. Like I said, it's an honor, and anyone's welcome to our stroke survivor group, but if you can't come to ours, I will also give you the link of the Connecticut list of stroke support groups for people to find in their areas if interested. So I just want people to get all the support that they possibly can get as stroke survivors. They're warriors is how I call them, and they deserve all the love and support that they can get, and we're here to give it.
Well, keep up the great work you're doing. It's so nice to meet you this evening. And with that, Michael, you want to send us out?
For episode 5 of...
You got it right. Michael has
season 2, episode 5. That's a wrap. Thank you very much, Brooke. Yeah. It's been a pleasure. Hopefully we can have this conversation again soon, and possibly David and I will come crash the next in-person symposium next year.
I look forward to it.
Thanks, Brooke. Have a nice evening.
You too. Bye. Thanks.